Today I'm going to talk about breathlessness, which is one of the commonest symptoms in patients attending the emergency department or they come in the clinic. Breathlessness is often diagnosed by different ways, but the most important tool that a physician has is observation. Uh, Take a minute, observe the patient. If they're in the emergency department, see what kind of breathlessness there is, whether they're unable to lie flat, whether they're coughing, they're wheezing, whether they're irritable, do they look blue, do they look swollen, is there edema which appears. Give yourself a minute before you touch the patient or even take a history. But I'm going to give you an idea as to how you can quickly assess these patients when you see them for the first time. So, breathlessness is called shortness of breath. That means somebody is short of breath. And the shortness of breath means that they have got low oxygen levels. In other words, they are hypoxic. And if you measure the oxygen level in the blood, you'll find that they are hypoxemic, which we often see with oxygen sat monitors, and then we can do an ABG test as well. Now, oxygen sat monitor are very common in the post-COVID era, and so patients who do have breathless at home, they often have an oxygen sat monitor at home. The the way to assess these patients is with this diagram. Either breathlessness can be because of low oxygen level. It can be because of a problems in the lungs or a problem in the heart. When I say the problem in the heart, I basically mean the cardiovascular system. And when I say the problem with the lungs, I mean the respiratory system. And we know that in respiratory system, that includes the chest muscles, the chest wall, the rib cage, the diaphragm. So all of those things are included when we talk about the lungs. And likewise with the heart, it includes the heart, the blood vessels, and the hemoglobin and the blood volume actually which is present. So there are these three possibilities if somebody is breathless. Now, when we say low oxygen level, that means if somebody is hypoxemic because perhaps they're living in a high altitude or because the environment where they are, there is low oxygen in the blood and there is low oxygen in the environment, so therefore they become hypoxemic. But often these patients, they will acclimatize in a few days time, and when they acclimatize in a few days time, it's unlikely that they will come to you with just mere breathlessness unless they have got a previous lung or a heart disease, in which case low oxygen concentration is going to cause more problems. So most often breathlessness means that either there is a problem with the lungs or there is a problem with the heart. Now, coming back to this diagram, this bit denotes the alveolus, and this in fact means that I'm talking about the whole of the lung. And this down here is the blood vessel, but once again I'm talking about the whole of the cardiovascular system. The area in between is where the oxygen transfer takes place. And this is very important these days. In fact, in the post-COVID, this has become very important. Now, if somebody had a problem with the lungs, either they had narrowing, that means there was reduced oxygen entering into the lung. So either you had asthma, or you had COPD, or you had a foreign body impacted. But for a foreign body to be impacted in the lower part of the lung is pretty uncommon. It's often in the upper airway tracts where a foreign body impacts, and that can cause breathlessness. So either either there is asthma, there is COPD. In this case, the patient often has a longish history. There is history of episodic breathlessness. There will be history of cough. There will be history of wheezing, and something which is quite apparent on auscultation as well. The second bit is that if there is a problem here, then there is a problem down here. And that means that this area is filled with some kind of fluid. Either this is filled with water, or there is pulmonary edema, or this is filled with secretions, as you see in bronchiectasis or pneumonia or bronchiectasis. So either there is fluid or there is this. And this can be diagnosed with, when you auscultate the patient, you will find crackles in the chest. And there are crackles, they're divided into three types. You've got the early inspiratory crackles, then you've got the mid inspiratory crackles, and you've got the late inspiratory crackles. The early inspiratory crackles are often because of chronic bronchitis and because of blockage here. The mid inspiratory crackles are the ones which you can see when there are secretions inside the lungs, and the late inspiratory crackles are the ones which you see when there is pulmonary edema or when there is lots and lots of secretion. So late inspiratory crackles you'll get when there is pulmonary edema. But there's another condition in which you get late inspiratory crackles, and that is ILD, that is interstitial lung disease. The way to differentiate between the two is ask the patient to cough and then auscultate. If the crepes change their consistency, then this is likely to be something inside the alveoli rather than on the outside. If the crackles remain the same, they remain constant, they're late inspiratory. That means that the initial bit of inspiration, you won't hear a crackle, so that'll be fine. But just in the latter part, you'll hear a crackle at the end of inspiration. So you have to listen very carefully. If that's the case and they do not change their type, then that means that you're dealing with interstitial lung disease, which means that there is pulmonary fibrosis. So there we have it. If there is a problem with the lungs, either there is narrowing or there is some kind of fluid inside. Now let's go on to number two, and that is a problem with the cardiovascular system. The cardiovascular system is important because obviously the heart has to pump the blood and the blood has to flow through the lungs as well to carry the oxygen. If there is heart failure, the heart will not be able to pump the blood and the person is going to become breathless. So the lungs are going to be congested, as we see with pulmonary edema or interstitial edema, or we see with alveolar edema. So the lungs will be congested. There will not be any space for oxygen and carbon dioxide to transfer across the lung. So either there is heart failure, so somebody presents with those symptoms, and they often have features of breathlessness on exhalation and then orthopnea and leading on to paroxysmal nocturnal dyspnea. Or there is a problem with the actual blood count. In other words, somebody's got a low hemoglobin level. Anemia is one of the commonest causes of breathlessness, but typically anemic breathlessness is breathlessness on exertion, because when somebody's at rest and they're chronically anemic, they've got an HB, for instance, about 7 or 8, and they have been in that range for some time. Their breathlessness will not be at rest, unlikely, until and unless the heart is compromised as well. Their breathlessness is going to be on exertion, and this gives you a clue. And the third one in heart failure is that there is something physically blocking the blood vessels, and that means that there is pulmonary edema. Suleiman, there is pulmonary edema. So either you've got heart failure, you've got problems with the blood count, you've got low hemoglobin, or you're dealing with pulmonary edema. So you've got these three things, and they can be diagnosed on history, on physical examination, and otherwise. And the third one is that if the lungs are all right, apparently, if there isn't any evidence of heart failure, but there is a problem with the oxygen and carbon dioxide transfer, that means this area, and this one is called as interstitial lung disease or pulmonary fibrosis. Pulmonary fibrosis is an underdiagnosed condition. In fact, it's perhaps more common than it is realized. And there are several causes for pulmonary fibrosis. Most of the patients is idiopathic. That means we don't really have a cause for it, but then it can be because of toxins, because of noxious substances, because of occupational problems. And indeed, in the post-COVID era, we know that lots and lots of patients who had severe COVID pneumonias. They ended up with interstitial lung disease and pulmonary fibrosis. Typically, patients with pulmonary fibrosis will have shortness of breath on exertion. They're unlikely to have breathlessness at rest. So, ILD and low hemoglobin, these are the two conditions in which there will be shortness of breath on exertion and not shortness of breath at rest. But nevertheless, in advanced ILDs, patients can experience breathlessness even at rest. So, in summary, if somebody is breathless, either they've got low oxygen level, which is an unlikely scenario, they've got problems with the lungs, there is either a ventilatory issue, for instance, they're unconscious, semi-conscious, they're under the influence of certain medications or certain drugs, or they have got fractures in the ribs, so that they've had a trauma, or thirdly is that they have got problem with their lung tissue as such, in which either it's COPD or there's asthma or there's fluid inside the lungs. And if that is not the case and you've ruled that out, then there is a problem with the cardiovascular system, in which case you either have heart failure, you've got low hemoglobin, and you've got a low blood count, there's anemia, there can be acute anemia causing breathlessness. And thirdly is there is pulmonary embolism. Now, with pulmonary embolism, there are three types usually of pulmonary embolism. We got mild, moderate, and severe. Usually, mild pulmonary edema, mild pulmonary emboli, that they usually do not cause significant shortness of breath. The moderate one can, and severe one will definitely do that. And with severe pulmonary embolism, you will also have cardiovascular instability. In other words, you will have low ejection fraction and you will have low BP. So only in severe cases of pulmonary edema, pulmonary embolism, will you get cardiovascular instability with a low ejection fraction and a low blood pressure. But with these patients with moderate pulmonary embolism, they will be breathless, and severe, most definitely, they will be breathless. Thank you.